Welcome to Module 3 of the presentation on anxiety disorder. In this module, we'll talk about which screening tool should be used for anxiety disorders and who should perform the screening. We talked about who should be screened and why in Module 2. Now let's talk more about the screen itself. The recommended screening tool for anxiety is the GAD-7, a 7-question test that can be used for adolescents and adults. The GAD-2 is a 2-question test that can be used for quickly screening clients at low risk for anxiety. A positive result leads to having to administer the GAD-7. There are additional tools available, including the Hospital Anxiety and Depression Scale and the Beck Anxiety Inventory. These 2 screens are also excellent tools, but are more time-consuming to administer. The Beck Anxiety Inventory is comprised of 21 symptoms that the patient is asked to score in terms of severity, and the Hospital Anxiety and Depression Scale is a 15-question test. Unlike the screening tools developed for assessing for depressive disorders, which include tools developed for specific subpopulations, such as pregnant and postpartum women or geriatric patients, different anxiety screens are targeted to specific types of anxiety disorders, such as panic attacks or phobias, rather than different population groups. Links to all of the screening tools discussed in this module are available in the Bibliography section for Module 3. Information about screening tools for patients under the age of 12 are discussed in the Pediatric Screening for Behavioral Health Disorders presentation. Before we discuss the tools in detail, let's talk for a moment about who can and should administer the screens. The screen is designed so that it can be self-administered by the patient or administered by a staff member. There are benefits for each type of administration. There is less staff time involved if the patient self-administers the screen, clearly a plus in a very busy practice. Having a paraprofessional in the practice administer the screen, however, allows an opportunity to build trust and the ability to assess the patient's understanding of the questions. Let's take a look at the screening tools. First, we'll review the GAD-7 screen. As you can see, the tool has 7 straightforward questions and answers with different score values for each. The scores are easily tallied into a final score. The table at the right side of the slide explains how the tabulated scores should be interpreted. For example, a score of 10 or higher can indicate a possible diagnosis of generalized anxiety disorder. Any scores above 5 should be followed up, as even mild anxiety may present problems for a patient. The GAD-2 screening is simply an abbreviated version of the GAD-7 screening. You may notice that the questions on the GAD-2 are identical to the first 2 questions of the GAD-7. This is a very efficient way to quickly screen a patient. If they score 3 or higher, you should follow up with the rest of the GAD-7. When first implementing the anxiety screening tool into your primary care practice, you may elect to perform the GAD-2 for all patients and then move on to the GAD-7 if the GAD-2 results are positive.